Joining me now is our good friend, one of America's amazing doctors and freedom fighters, Dr. Simone Gold. Dr. Gold, good morning this morning, young lady. How you doing today?
Hi, good morning, Dr. Eric. How are you?
I'm doing very well. It's always great to have you on. You have so many great things going on. You know, I love the fact, Dr. Simone Gold, that you're always talking about medical Marxism and the fraud in the corporate media, and really about Gold Care and about all the things that you're doing to help fight medical tyranny. Give us a lowdown of what you're up to now, and give us some insight on how we can participate, especially with Gold Care.
Yeah, thank you so much. You know, for the first year or two of this fight, people would ask me, how do I get medicine? Or like in your case, you knew about natural options, but
Right.
in my lane, people are always looking for prescription medicines. And that was the thing I was focused on for maybe the first year and a half. And of course, the litigation to stop our federal government from doing the awful things it was doing. But the last year to two, I've really been thinking, what alternatives can we bring to the American people so that they can find the answers that they need, because the enemy is the fear and the propaganda, right? The enemy is that the government or media, big tech, tells you things, makes you afraid, and then in your ignorance and fear, you voluntarily give up your inalienable rights. So my lane is to help provide people information that refuses or that empowers the person to fight back successfully in their own life. So the biggest area in which you can do that is actually the medical area. I really think that there's two areas we need to take back. One is education, the other is medical.
Oh, yeah.
So education I'll leave to others, but in terms of the medical space, why is it that Americans can't just hire a consultant doctor and ask that doctor their opinion and either take or leave that advice, right? But at least they know they're getting unbiased advice, because our system isn't set up to work like that. Our system has third-party intermediaries, essentially run by the socialized Medicare system, which then downstream affects the private insurers. But essentially, you can't even hire a doctor for that doctor-patient relationship. So the solution are people like myself. Goldcare.com is one of those solutions where you can find a doctor, pay that doctor, get unbiased advice, and then we can begin to, for example, talk about things that you know well, right? The vitamin D, for which the government came after you for, vitamin C, all the natural options that can help people, right? Well, right now, doctors are incentivized to sell you things, lab tests, x-rays, pharmaceuticals, etc. Those things are sometimes indicated, but how do you know if they're indicated if the doctor's not working for you, right? So we need doctors just to work for patients. That's what goldcare.com is.
Well, Dr. Gold, you're so spot on, and I really would love for you to hit on, so our listeners can hear, the fact that your health insurance should not dictate the level of health or care that you as an individual get. And I know people understand this and feel this, but you know, the average out-of-pocket deductible per year, at least the information that we've gotten from our people, is the average out-of-pocket is about $5,700 per year for their deductible. Once they meet their deductible, then their insurance might cover some of the services. But like you said, there are so many things that really help get to the root cause of a problem, and it's not, the insurance won't cover that. In fact, Medicare guidelines says something to the effect that if a treatment is set to prevent, treat, or mitigate the deteriorating chronic diseases or prevent illness from occurring, it's not deemed medically necessary. Well, what the hell is healthcare then if that's not covered? I mean, Medicare is not covering those things. So, Dr. Gold, talk a little bit about your experience of patients who really their insurance dictated the level of health or care they got, and it led to, unfortunately, the wrong either course of care or something that is not going to help the patient. What are your thoughts on that?
Exactly. So there's really two huge things going on that are bad for Americans, bad for patients. One is that you're being robbed every month and every year of an obscene amount of money. And the second is that your medical decisions are not being made by you, and honestly, oftentimes not even being made by the doctor who you think you've hired. Those two things are a problem. Let's talk about the money first. In addition to the average deductible being about $5,700, it's about right. It probably ends up a bit higher, but you're also paying premiums of $24,000 a year. Those premiums for family of four, $24,000 a year. That's before you see a doctor. Then you've got your deductible, Then you've got the copay, the coinsurance, and all of that. So to add insult to injury, you're not actually getting better health for that. We have terrible markers of health. We're obese, we're taking lots of medications, our life expectancy is worse than other Western nations, our infant mortality is worse. By all measures, we're getting nothing for this money. In addition, you go to the doctor that you paid now to the insurance company $2,000 a month, $24,000 a year, plus your deductibles, right? Mm-hmm. And you're not necessarily getting unbiased advice. We saw, well, that in the COVID era, Medicare was paying hospitals more money to give them bad medicines like remdesivir, which killed your kidneys and had a very high mortality rate, and not give safe medicines like ivermectin and safe over-the-counter techniques like vitamin D, right? So Medicare was specifically incentivized to do the wrong thing, and you're paying for it.
It's absolutely, Simone Gold, Dr. Simone Gold, you're so right. You guys, this is what I'm telling you guys. Everybody, when you get a chance, I want you to go do this right now. Go to DrSimoneGold.com. That's their website. Go to DrSimoneGold.com and then go check out GoldCare.com as well. You've got to figure out, you've got to learn how to unplug from the matrix of symptoms and disease management. You've got to start finding the root cause of your problem, and you've got to be participating with individuals that are going to help you do that, and they're not going to be pressured by your health insurance, which quite honestly is an oxymoron because it's not about health. And I don't know what they're insuring other than the fact that you're getting raped and pillaged, like Dr. Gold said, $24,000 a year for a premium. It's absolutely insanity what's happening. And I really love what you're doing, Dr. Gold, with Gold Care. It makes so much sense. It's safe, it's affordable, it's convenient. I mean, the program you have is absolutely amazing. Now, I tell you what, Dr. Gold, I've got to take a break here in just a second. I know you're super busy. Is there any way, can you hang with me over this break? Because I'd really love.
You've got me,
good.
Yes.
I'd really love. Tell folks before we get out of here where they can follow you, find you, and all that stuff before we take our first break here.
Great. Please come find me on Twitter, and please come find me on the web, Dr. Simone Gold, DrSimoneGold.com. We've got all kinds of answers for you.
Awesome. We'll be right back, folks. You're listening to Real Talk with Dr. Eric Laputi. Hang tight. Welcome back to Real Talk with Dr. Eric Laputi. We're joined by American patriot, just amazing woman, Dr. Simone Gold. Go check out her website, DrSimoneGold.com or GoldCare.com. Before the break, we were talking a little bit about Gold Care, about the whole reason why a parallel healthcare system has to come out of all this craziness. People want to get to the root cause of their problems. They want to have doctors that are going to listen to them, people that are going to help them find the reason why they've got it, and help not just give drugs, but make lifestyle changes as well to help them get to where they want to be. So, Dr. Simone Gold, tell everybody a little bit, really why Gold Care came out. What frustrations? Because, I mean, listen, this is not, you're trained as a you're a licensed emergency room physician and a lawyer, by the way, which, the insurance world is very dominated in the hospital, especially emergency rooms. So how did you get from your original training to where you are now? Give us a little bit of insight on that journey.
Yeah, my dad's a doctor, and I became a doctor, and I've just been, the heart of a doctor all my life. And I saw a lot of injustice over the years as a doctor, prior to COVID, that things were not really done in the patient's best interest. I saw that over and over and over. But in general, you could navigate in a way that was pro-patient, but maybe more expensive and inconvenient for the patient, let's say. I wouldn't say I saw things that were flat out detrimental to the patient. Specific medical policies that were bad. But that all changed during COVID. During COVID, it was super obvious that the doctors, the nurses, the hospitals were all acting not in the patient's best interest. It was shocking. I do think a lot of the doctors and the nurses on the front lines were unwitting accomplices to this, and I think the policies were made above them for the most part. But nonetheless, that's what it was. And when you look at the root causes, to dumb it down, it's simply that the doctor doesn't work for you. Definitely the hospital doesn't work for you, but the doctor doesn't work for you either. That was the core problem. You could talk about little solutions on the edges, but until you have a situation where you're paying for the consultant in front of you, you can't be sure the quality of the answers that you're getting. And then when you look at the macro view, are we getting healthier by all of these expenses, right? We're spending 20% of our gross domestic product on health expenses. Well, maybe that would be worth it if we were living extraordinarily healthy, long lives. But we're not. we're obese, and we're drug dependent. Not just the opiates that are out there, but prescription pharmaceuticals, right? So all of this combined, and I now have an opportunity because I have a bit of a platform to change it for the better, and that's goldcare.com. I really just want to encourage people because you need to, I call it the medical industrial complex. You need to rid yourself of the medical industrial complex influencing your life. And I'm here to tell you that it can be done less expensively than whatever you're doing now. That's always very shocking to people. I've been off the medical industrial complex myself, as a patient myself, for more than 10 years. So it's absolutely doable. So we show you how at goldcare.com.
Dr. Gold, I'm so proud of you for everything you've done and what you've stood through. And I mean, the last 3 years has been tough on a lot of people. I know it's been tough on me, but I know it's also been a tough journey and battle on you as well. But, I love that phrase in life, and I know it's been said many different ways. What doesn't kill us makes us stronger. I mean, look, you and I have a lot of stuff in common. We've been persecuted. We've been ridiculed. We've been vilified. We've had all these things, and we've been vindicated, both of us, many, many, many times. In fact, I think you have like multiple 9 lives of a cat, because every time I think, oh my gosh, Simone, Dr. Gold has got this going on, you just rise from the ashes like a phoenix again. And I'm just so proud of you for being able to rebound from the things that you've dealt with. And I know that learning, when the more that we learn and we experience, the more certain we become. And I know that's one of the reasons why Gold Care has come out of all of this stress and press, because you've the pressure and stress that you've seen, you've evolved into this just amazing healthcare system because of that. And one of the things was, obviously everybody remembers, Dr. Gold, you standing in front of the steps of the Supreme Court and making your declaration out there in front of the America's Frontline Doctors. And then, like a lot of things, good intentioned people turn into, well, not so good intentioned, and etc. There was obviously some drama that happened with the American Frontline Doctors, especially whenever, you, with the January 6th issue, had to spend a little time in federal prison, which is just ridiculous. Talk to us about that saga, and you've also just been vindicated yet again. So what's going on, Dr. Gold?
Yeah, thanks for the question. So I try not to talk about it too much because I didn't want to draw too much negative attention. But for those of you who are listening to Dr. Eric and you've heard some of the drama he's talking about, specifically, much like James O'Keefe had to battle his board on Project Veritas and then he just walked away, I was put in a situation where there were rogue board members who were stealing, let's just say stealing, flat out stealing. And as you mentioned, I was actually incarcerated due to being at the Capitol giving a speech, which I was authorized to do, but I was there on January 6th, and I ended up being sentenced to 60 days in prison. And when I was away, this rogue board member attempted a hostile takeover of America's Frontline Doctors. When I got out and I discovered this, I attempted to put a stop to it. Instead of just resigning, he defamed me, and you may have heard some very negative things about me, that I took money from the American people, et cetera, et cetera. It was all completely false. And it takes a long time for the truth to come out. What's that expression? The truth, a lie gets halfway around the world before the truth has a chance to put its pants on. Mm-hmm. But I asked my supporters, just be patient. The truth will out. And it's now coming out. The rogue board member who accused me, he's since quit. All the lawyers against me on his side quit. The board members who were kind of just silent on the side have now flipped to my side. It's all coming out. And I just ask the American people to just have faith in me. I just want to make things better, like Dr. Naputi. I just want to work towards the common good of our nation. People ask me why I do what I do, and my answer is very simple. I don't want to live in China. I don't want my children to live in China. If we don't push back hard, that's where we're going. So, yes, I've absolutely been vindicated. We will shortly be able to put all the drama behind us.
Amen.
And I want to give you a little sneak peek. I won't tell you all the details, but I'm just going to remind you that the 3rd anniversary of the White Coat Summit is coming up, and I've got something special planned.
Right on. Well, Dr. Simone Gold, that does not surprise me about you. You're always thinking about what's next, what can be bigger, what can be better. And I'll tell you, just so everybody knows, I've seen Simone from 2020 until 2023. She's always done what she says she's going to do. I will tell you that I'm a fan. I support you. I mean, I trust you, Dr. Gold, because you always do the right thing. And to me, that's the only thing that matters. And that's why I'm such a big fan of goldcare.com, and such a big fan of what you're putting out and what you're doing, Dr. Simone Gold. I've got about 2 minutes left before I got to let you go here. What's your final thoughts, call to actions, or other information that you'd love the world to know about?
Thanks. I just want to encourage people not to get discouraged and overwhelmed by constant bad news. We're just barraged with that every day, right? We're just, oh, you can't do it. You can't do anything. I'm just a single person. It's not true. It's not true. One of the things you can do in my lane, for example, is you can remove the medical industrial complex from your life. You can consider homeschooling in your life. You can become informed and also not allow your voice to be silenced, right? That's another thing they do, is they kind of try to gaslight you and convince you not to talk to other people. You're a little bit afraid. Don't do that. Just be joyful, speak your mind, listen to people that you respect, perhaps me, perhaps Dr. Eric, etc. And I would just say, have faith in yourself and have faith in God, who's got this.
Yeah, amen. Dr. Simone Gold, thank you so much for taking time out of your busy, crazy day to spend a little time with us, and keep up the great work. If there's ever anything we can do to help support you and what you're doing, just let us know. And I'm just encouraging everyone to go check out DrSimoneGold.com. Go to her website, goldcare.com. That's goldcare.com. Go learn about this new process that's out there that is really helping lots and lots of people. Dr. Simone Gold, thank you so much for who you are and what you're doing, and thank you so much for your time today. I appreciate you, and I look forward to seeing you soon.
Thank you. See you soon.
All right.
Bye.
Bye-bye.